Emergency medicine procedure, needle cricothyroidotomy. So the indications for the needle crico, which is in the puncture with the needle of the cricothyroid membrane, are following. So as a matter of fact, you do it in the situation when you are unable to provide oxygen to the patient. When other ways of opening the airways are futile to introduce, like intubation or supraglottic device. So if you fail to intubate the patient, if you fail to introduce a supraglottic device, if they are not working, if you cannot provide oxygen, and if you cannot ventilate the patient through the bag and mask ventilation, so the situation can't intubate, can't oxygenate with the patient with decreasing SpO2, then you have to go for the needle cricothyroidotomy because your patient will go into the deeper hypoxemia and finally we go into the cardiac arrest. So what clinical situations are responsible for such a state? The situation is in which we've got the patient gets laryngeal edema at the level of vocal cords or upper airways. Situations like foreign object in the larynx, craniofacial trauma, throat trauma, thermal or chemical injury or burn of the upper airways, and anaphylactic reaction. In most of the cases, patients at emergency department that need needle cricothyroidotomy are the ones with anaphylactic reaction, burning injury to the upper airways, and facial trauma. Remember that the gold standard procedure in such situation, in the situation of cannot intubate, cannot ventilate when the saturation is going down, is the surgical cricothyroidotomy. That's the gold standard. The needle cricothyroidotomy is the procedure which is time limited, is a temporal way of delivering the oxygen to the patient in this CICO situation. Okay, so remember, it's not a gold standard, it's just temporal way. So how the procedure looks like. So first of all, you've got a patient in the supine position. Usually it will be like that. It helps to tilt the head backwards. And then the most important thing, you have to locate the cricothyroid membrane, which is between the thyroid and cricoid cartilage. As you see on this picture, I recommend to go to palpate from down, and you go up. First you find a cricothyroid membrane, then you've got a small let's say depression, and that's the place of the cricothyroid membrane, and then you've got thyroid cartilage. So that's the place where you perform needle or surgical cricothyroidotomy. So first you have to find the place and the anatomy of the patient. It would be nice if it would help you. Then you take the syringe, 10 milliliter syringe, half filled with saline. You attach to the syringe the wide bore cannula, so the biggest one you've got. In my work, the biggest one is 14G cannula, the orange one, and you puncture the cricothyroid membrane over the inferior margin of this membrane. So as you can see here, like inferior margin of it, and you should direct it, let's say, at least 30 to 45 degrees angle towards the feet, so in direction to the chest. And you advance the catheter, so you go with the catheter deeper and deeper, but all the time you should continuously apply the negative pressure to the syringe until the bubbles are seen in the syringe. And the bubbles would mean that you are in some space with the air, and in this case it would be intratracheal placement. So if you see the bubbles, you should advance the catheter, so the plastic part, forward over the needle. So you slide the plastic catheter over the needle until the hub rests at the skin surface. So after this part will rest at the skin surface. So in that moment, the cannula, the catheter will go downwards into the trachea. So then you remove the syringe and you remove the needle. So you've got the catheter inside, and then you should reattach the syringe to the catheter and one more time apply the negative pressure to check if you can see the bubbles, so to confirm that you are in the right place. So let's say we almost done, and then how to provide the oxygen through the catheter which is in the cricothyroid membrane. So you've got two options. Or you will attach the high pressure tubing oxygen tube with 100% of oxygen, 15 liters per minute flow to the end of the catheter. And how to do it? You just take the oxygen tube. The simplest way is to cut the hole with the scissors and attach this ending to the catheter, and then turn on the 15 liter per minute flow of oxygen. And then to push the oxygen to the lungs, you have to close this hole for 1 second, and then to enable exhale, you should open it for 4 seconds. So just push 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So for 1 second is inhalation, for 4 seconds is exhalation. So that's one way. The second way to provide oxygen to the lungs through the needle, through the catheter, is to attach the bag to it, but we have to make some kind of adapter. So one option is to directly attach the ending of the endotracheal tube number 3 to the catheter, and then you can attach the bag and mask, the self-inflating bag, or you can attach the 5 milliliter syringe and then put the ending of the number 6 and endotracheal tube. That's the second option of providing the oxygen to the lungs through the needle cricothyroidotomy. Be careful because the exhalation in this method is through the glottis. So if the glottis is completely closed, then there is no way that the air can get out, and if you will not notice it, then the barotrauma will happen. Okay, so do not use this method if the glottis is totally closed. And how to check it? If you would see that the chest is not, let's say, going down during the exhalation, but the volume of the chest is increasing, then you should stop providing the oxygen through this method. The method allows to provide the right amount of oxygen, but it's not effective in removing carbon dioxide. So this method can be used only maximum for 45 minutes. So as I told you before, the gold standard is surgical cricothyroidotomy. So as soon as you manage to provide some oxygen to the patient through the catheter, you should as fast as possible organize help to help you, or organize the equipment to perform surgical cricothyroidotomy. And the most important complications of this procedure is esophageal perforation done by the needle that you introduce to the trachea. Then subcutaneous emphysema if you will not get to the trachea but to subcutaneous tissue, and you will push the oxygen to subcutaneous tissue, then you will have subcutaneous emphysema. So it's very important to keep all the time the catheter in place, not to remove it. Barotrauma, as I told you before, so be careful about it, and hemorrhage might be also the complication of needle cricothyroidotomy. And if you would like to watch the procedure done by the other experts, you can watch the film on YouTube, and here that's the link for the YouTube film for you.